Samir Abdulnar, who is a partner in Hanson Bridget's Environment, Natural Resources, and Land Use Practice Group. He advises clients on state and federal hazardous waste management, storage, and disposal laws across a variety of industries. He's been working specifically with assisted living communities on waste management issues for the past 2 years. In addition to his expertise in environmental law, Samir is the director of Hanson Bridget's pro bono and social impact programs. Glenn Thomas is the Director of Safety and Risk Management for Continuing Life. He oversees all safety, security, risk management, and disaster response operations. Glenn began his career in public safety in 1997 as an emergency medical technician and continued his career with CAL FIRE and San Diego Fire and Rescue as a firefighter EMT. Glenn has served on various emergency response and disaster response and mitigation task forces and operations. Liliana Callis is an environmental scientist for the Office of Policy of the Department of Toxic Substances Control, where she focuses on projects relating to specific waste streams, such as hazardous waste pharmaceuticals. Liliana's background is in environmental chemistry with a focus on chemicals of concern and their potential risks. And Jessica Twining is a branch chief in DTSC's Office of Policy, where her group provides regulatory assistance to industry and stakeholders and coordinates with US EPA on the Federal Hazardous Waste Program in California. And now I'm going to turn it over to Samir.
Thank you, Selena. Thank you for that introduction. Good morning, everybody. I'm going to go ahead and share my screen. We've got a slide presentation for you today. Okay, hopefully everybody can see that screen. As Selena mentioned, we're going to focus today's webinar specifically on management and disposal of hazardous waste. And I'm thrilled to be joined by Glenn and Jessica and Liliana to talk about these important issues. And specifically the difference between hazardous waste and what can be managed differently as medical waste and pharmaceutical waste under state law. And we're going to get into a lot of those details. Last week, Cala presented part 1 of the series, and that covered generally the handling of hazardous materials, especially as they relate to employee safety. And there was an introduction there that actually Glenn gave on some of the hazardous waste material we'll be covering today, but we'll drill down a little deeper today into that topic. If you were not able to attend last week's presentation, you can get a recording of it and the materials from that presentation from Cala. Okay, so there are 2 sets of waste classification statutes and then the regulations, the rules that implement them that are used in California. There's a federal framework and there's a state framework, and they're both applicable. So the state law covers part of the waste streams that assisted living facilities generate, but they don't cover all of them. Federal law fills in the gaps where state law doesn't cover. In California, as elsewhere, the individual or the entity, or in this case, the community that generates the waste is who is responsible to determine whether that's a hazardous waste that needs to be managed and under which structure, which set of statutes and laws. So as I mentioned, there's a federal structure and a state structure. All of you, I'm sure, are quite familiar with the California Medical Waste Management Act. That's a state law, and it regulates medical waste that's generated by, among other communities, assisted living facilities. The definition of medical waste in that state law does include pharmaceutical waste and medications. However, there's a carve out. It doesn't cover every pharmaceutical waste that might commonly be encountered in one of your communities. Specifically, it does not include hazardous waste that's regulated under federal law by the Federal Resource Conservation and Recovery Act. So this is where that matrix of state law and federal law really kind of comes into play. The Resource Conservation and Recovery Act, as I mentioned, it's a federal law. The acronym RCRA is commonly referred to as RCRA. And again, there are a set of pharmaceutical medications that are considered hazardous under this federal RCRA law, and they have to be managed as hazardous waste. They cannot be managed the same way you manage other medical waste under the state's Medical Waste Management Act. So I mentioned that Glenn covered a little bit of this background during last week's webinar. This slide or the image on the slide may look familiar to those of you who attended last week's webinar. What is a RCRA hazardous waste? There are two ways to really figure that out. The United States Environmental Protection Agency, or EPA, actually publishes 4 different lists of substances that are known to US EPA to be hazardous, and then when they become waste, they must be managed as hazardous waste. For purposes of assisted living facilities, the 2 lists that are relevant are the P list and the U list. And again, those are published by US EPA. Those are available online. I'll provide a link to those shortly. The other way to determine whether something is hazardous, besides looking at one of the lists that EPA publishes, is to determine whether it meets at least one of 4 characteristics of a hazardous waste. So this is true even if it's not on one of the lists that EPA publishes. And those are ignitability, corrosivity, reactivity, and toxicity. This can be a fairly complicated and technical determination. It has to do with obviously the compounds, the chemicals, the things that are within a particular substance, the concentrations of those. A lot of information to help this determination can be found on a chemicals safety data sheet. But again, this can be technical and it tends to be a case-by-case situation. All right, but for your purposes, the good news is that the list of commonly encountered medications at assisted living facilities that qualify as RCRA hazardous waste is a relatively short list, and we'll talk about that next. So this is what you're interested in. Which pharmaceuticals are hazardous waste? Here's a list of six pharmaceuticals, 6 substances that you might encounter at your facilities that need to be managed under the federal RCRA hazardous waste regime and cannot be managed as typical medical waste under the state Medical Waste Management Act. 2 of these, Coumadin, warfarin, and also nicotine, and I'll talk about nicotine in just a minute, are P-listed waste, which means they are acutely hazardous, and I'll talk about why that's important a little bit later. You'll notice there in the parenthetical that nicotine is hazardous waste, but only for non-over-the-counter nicotine replacement therapies. So nicotine patches, nicotine gums, those that are sold over the counter, those are not considered hazardous waste. There's a carve out for that in state law and soon in federal law. But if you've got any nicotine substances that are prescription, that are not the OTC NRTs, then those need to be managed as hazardous. You'll also see inhalers on there, and inhalers can be used for a variety of different purposes. There's some questions and some unresolved issues about the hazardous characteristics of inhalers. If they do contain an ignitable propellant, then that's one good indication that they need to be managed as hazardous waste. Okay, so what to do with this list? If your community generates any of these wastes, you are a hazardous waste generator, and that triggers some requirements and obligations on your community that we'll get into. Very, very, very important takeaway. Any of the things that you see on this list, and in fact, any pharmaceuticals that qualify as hazardous waste cannot be mixed in a waste container with other non-hazardous waste or other medical waste. They have to be managed separately. That's a very, very important takeaway of this entire webinar. There's a link here, as I mentioned. EPA publishes a lot of information on the management of hazardous waste pharmaceuticals. So you'll get a copy of this presentation, and that link is there. And if you haven't looked at that, you can take that, take a look at what's over there. All right, so let's talk about those various requirements. So I mentioned at the beginning, we've got Medical Waste Management Act, state structure, and then federal RCRA for hazardous waste. And each of those have different requirements for registration as a facility, for how you store the wastes and where you store them, for how long you can store those wastes in a waste container, how you dispose of them, and then additional requirements, including record keeping and different fees that apply. Now, I want to point out the footnote at the bottom of this slide and this waste table. These requirements are for small quantity generators. The majority of your facilities, I think in all likelihood, will be considered small quantity generators. A little bit later, I'll talk about what takes you out of that realm into a large quantity generator. But again, I think in all likelihood, you will be considered a small quantity generator based on the amount of medical or hazardous waste that you're generating. If you are a large quantity generators, there are some different requirements. They're a little bit more onerous. So I'm going to actually pause here because this is a lot of information and it's a lot to keep track of, especially when considering which pharmaceuticals fall under which bucket of regulation here. So for some people, as Selena mentioned, these regulations have been around a while, but for some people in the assisted living world, the hazardous waste regime may be new to you in terms of the requirements that you're obligated to follow there. Glenn is somebody who's been working on these issues for a long time with continuing life. He's the one responsible for making sure the communities are in compliance. So Glenn, I'm going to put a question to you. Where would you recommend somebody who is new to this regulatory structure and new to these requirements? Where's a good place to start? Because it's a lot here.
Thanks, Samir. And again, thanks to Cal for the opportunity to present again and follow up on last week's webinar as we dig a little bit deeper into this issue. So where do we start is obviously the big question. And my recommendation for where to start would be go on the EPA website with the link that Samir previously spoke about and ensure your community has and is registered and they have an EPA ID number. That's going to be number one. If you're not sure, you're newer to your organization, it just doesn't ring a bell to you, you can go on and you can search by nothing more than the state that you're in and the name of your facility, and it will tell you whether or not you have an EPA ID number and whether or not that ID number is current and what type of generator you're classified as. And it will likely be the small quantity generator. So that is the starting point for where we should start. Secondly, there's tons of internet resources out there where we've tried to provide to everybody the most relevant resources, whether it's through DTSC website, which has a lot of resources on there, and maybe we'll speak a little bit more about that later. Also, there is an instructional form that you can fill out that links you to how to obtain a registration number. So we provided that for you as well. So those are going to be the starting points. Once we verify that, then we'll get a little bit deeper into, best practices associated with how to obtain the proper bins, training, and that type of thing. But the basic framework should be verify you have an EPA ID number. If you don't, register for one, because you cannot develop a relationship, and we'll talk about this later in the presentation, but you cannot develop a relationship with the waste hauler if you do not have an EPA ID number. So that's going to be the basic framework for where we want to start.
Great, thanks, Glenn. And so you'll see the slide I've got up here provides links on how to obtain an ID number. I had a slide up here previously. I'm going to go back to it in just a second that talks a little bit more about what Glenn was talking about with what the EPA ID number does. It's a registration, but it's also it's a way that helps EPA track what's happening with hazardous waste. There's a system of documenting really the life cycle of the waste from the moment it leaves the facility to the moment it ends up in a hazardous waste landfill, and that's done through hazardous waste manifests. That's how EPA knows what's happened to the hazardous waste, what they call from the cradle to the grave. The cradle being the time that it's generated, that somebody has determined this is now a waste item. It's not something I can use anymore. I need to dispose of it. And then to the grave, where it finally ends up as a hazardous waste landfill. And of course, if you don't have an EPA ID number, then a waste hauler is not going to take hazardous waste off your hands. They're not supposed to take hazardous waste off your hands. They're not allowed to. And of course, if they do, then they expose themselves to liability. We are going to get into some of the other best practices in just a minute, but I do want to note here that, you know, a lot of you deal with pharmacy vendors, and I'm going to go back to the table slide. So for medical waste, there are pharmacy vendors that have an unused pill mail-back system. So anything that's not used, you can send it back in an envelope and they'll take it back. Now, here's a question I'm gonna pose to one of our DTSC panelists. If a community just sends something back to their pharmacy vendor unused, can they just rely on that process to ensure that they are in compliance with these various waste regimes? Can they just kind of turn that responsibility over to the vendor that has sent them these envelopes to mail pills back in? And I'll let either Jessica or Liliana address that.
Hey, Samir, I can go ahead and speak a little bit to that. The management of hazardous waste really depends on who the generator is. So generally speaking, if a resident generates pharmaceutical waste in their residence, the collection of these pharmaceuticals through, for example, like a take back program or in a receptacle are not subject to hazardous waste requirements. However, I do want to note that there might be other requirements that are applicable to these medications, such as maybe from DEA or CDPH. But as far as hazardous waste regulations, again, dependent on the generator from residents, would not be subject to them.
Great, thank you. Okay, so, you know, Glenn has advised the step one is make sure you have your EPA ID number, and I've shared some links on how to do that. One of the things I said earlier is, you know, one of the main key takeaways of this presentation is the importance of not mixing hazardous waste in the same container as non-hazardous waste. So let me ask this question to you, Glenn, because during last week's webinar, you talked about the 3 different waste containers that are common in these facilities, and they're listed here on this table. You've got a white container with a blue lid for non-hazardous pharmaceutical waste. You've got a red container for biohazard and syringes, sharps. You've got a black container for hazardous waste. And I'll move over to that slide to show you what that looks like. So can you just put everything in the hazardous waste container? I mean, I know you're not supposed to put hazardous waste into a non-haz waste container, but can you go in the other direction and just put everything in the hazard waste container? And if you do, what does that require? Or what does that kind of obligate you to do?
Sure, good question. So the short answer is no. You know, the short list of medications that we spoke about, the Coumadin, the warfarin, and those type of medications that are P listed, that belong in the black waste containers, those are the only things that should be going in there. And that the reason for that is compatibility many times is the issue. Compatibility with, those medications and other medications. We never want to just mix them together and assume they're going to be okay. So as we mentioned last week, the general rule of thumb for that white container with the blue lid, more so intended for your, I don't want to say, well, we'll call it general run-of-the-mill common medications, over-the-counter and or prescription medications that are not classified as narcotics or P-listed through RCRA. Those are the ones that we can put in that white container with the blue lid and feel good that there's the likelihood of compatibility issue is very minimal. Other than that, everything should be those other medications that are listed, that are commonly found in our assisted living facilities that are P-listed, again, should make their way into that black container. If you notice that black container, it has a yellow, on the top, you'll see the yellow portion of it. That's so you can't get in that container after you put something in. The whole purpose is we're not supposed to be able to go in there, remove things later, so on and so forth. So chain of custody, the security measures associated with these containers is another thing we wanted to talk about and what that looks like in our facilities. And some of the best practices associated with that, number one, are going to be make sure these containers, make sure your med rooms where these containers likely start their lives, where they live, are secured. They're secured via hard key and or preferably access control. So then you have some audit trail to be able to determine who's going in and out of that room. Not all facilities will be able to do that, understanding that. So you need to make sure you have good key control processes. Another thing for a lot of the communities, or actually for all the communities that I support with Continuing Life, we actually instituted cameras in our med rooms. And the reason we've done that is because we've had issues in the past, specifically with narcotic waste disposal. And unfortunately, sometimes there can be theft-related issues with narcotics. It really helps to keep people honest, do the right thing. And if something does come up, you have a means to go back and to be able to conduct proper investigation and that type of thing. And going back to the reason why we don't want to mix those medications, you're going to have a separate agreement with your medical waste hauler that's going to haul away that black container. You'll have one agreement for sharps. You'll likely have another agreement for general medical waste, and then you'll have another agreement for the black container, which again are those acutely toxic or potentially acutely toxic medications. You have another agreement for those because the way they're actually disposed of are differently when we talk about that term cradle to grave meaning final disposal. It's the method in which we do so is different. And then the last thing I wanted to bring up regarding that is, as a follow-up to last week, is the question came up regarding RX Destroyer and can we use that and how do we use it? Yes, we can use RX Destroyer. RX Destroyer is intended to be used by itself. It's formulated, it's in the bottle. The instructions are very clear on types of medications that can go in there in pill format, emptying syringes into there. You're not supposed to put the whole syringe, but emptying the plunger of a syringe into there. So RX Destroyer is a way that you can manage your narcotic waste specifically. It's a good means to manage your narcotic waste, but you always want to also fall back on your facility's current policies, procedures regarding how you handle those narcotics and how you waste those narcotics. But RX Destroyer is a very viable option to be able to manage that classification of waste as well.
Thanks, Glenn. Speaking of RX Destroyer, if you put something in there that qualifies as federal hazardous waste, what happens as far as your requirements to manage now your RX Destroyer waste?
That arms destroyer waste should really be handled in a very similar fashion to the black bin. It really, you're not going to do anything much different than you would the black bin. So obviously, so that RX destroyer, you'll tell your medical waste hauler that obviously you're using RX destroyer. That will be evident to them, and they'll handle it as per the requirement of the cradle end of the disposal as well, similar they would to the black waste. So really, not to further confuse anybody, but really RX Destroyer, all you're doing is adding a fourth means of disposal for those controlled substances. So now we have sharps containers for sharps. We have white containers with blue lids for your general medical waste. We have black containers for our P-listed narcotics that have compatibility issues. And again, that list should be a relatively short list that we provided, those 6 or so medications. It can grow. We understand that it could grow, but those are the most common ones. And then for your narcotics waste issues as well, you can have RX Destroyer and use that and make sure that's written into your policy, and that should be handled in a very similar fashion as your black container. As another best practice to ensure that all these things are being maintained in a secure environment. We talked about them being maintained in a locked room behind lock and key or access control. But the other thing will be many times these black waste, specifically the black waste containers and the RX destroyers, they actually have a wall mount cradle with a chain attached to it. So you have additional security related to those bins, so they don't grow. Potential of growing legs kind of is significantly minimized. So making sure that we're addressing the security side of these bins as well is important.
Yeah, absolutely. I'm going to share some links, some resources for some waste disposal providers who, can help you with the management of the different, whether it's the 3 or the 4 categories of waste that you're dealing with. And again, you're going to have access to these. You may be familiar with these already, but if not, these are a good place to start.
Samir,
Yes.
do you mind if I add on to Glenn's comment about the RX Destroyer?
Please.
So as I understand the RX Destroyer, and I'm by no means an expert, but my understanding of it is that its goal is to essentially like make the medications that are put in there unrecognizable. It's not necessarily intended to treat, but it's just meant to like lump them all together so they're non-retrievable. I will caveat that I know EPA, or from what I understand, EPA considers these to be considered a container. California has a bit of a different, broader definition of what we consider treatment. So it is something we're currently evaluating, whether that's considered a treatment device or if it would be considered a containment in the same way that EPA would consider it to be a container. So I want to just put it out there that it is something we're aware of and we're evaluating right now. And once we make that determination, we will definitely put it on our website so it's clear and understandable. But we just want to make sure you're all managing the waste appropriately, and there's no surprises during inspections.
Yeah, thank you for that additional context. And that's particularly relevant, Jessica, I think where you're going with that, but correct me if I'm wrong, if something that would be considered RCRA hazardous ends up in that RX destroyer and the determination of whether California considers that treatment or storage becomes really relevant at that point. Is that right?
Correct, yeah.
Yeah, okay. So you did mention inspections and kind of what happens at inspections, and we can talk a little bit about some of the common types of issues that have been found or have been raised by inspectors over the last couple of years at assisted living facilities. And Glenn, I don't know if you want to share some things from your experience and then best practices to deal with those. I'm also going to ask DTSC, and maybe we'll start there. Maybe I'll start with this question to DTSC, which is, what would you recommend to somebody who's visited by an inspector, by their Coupa, who's looking at these issues, and maybe for the first time hearing the inspector say, asking questions about hazardous waste and, identifying the fact that, oh, you've disposed of coumadin or warfarin, so you're a hazardous waste generator. So how do you recommend the community kind of approach that process and respond?
I can provide a little bit of information of some online resources, and Jessica, if there's something I left out, please go ahead and add to it. But one sort of area that we have is online. We have contact information for the Regulatory Assistance Office. So if you have specific questions related to hazardous waste regulations, so like compliance assistance or requirements, they can help with some of the questions that you received during the inspection. Maybe afterwards you have questions. I do want to add that they do receive quite a bit of volume every day, so it might take a little bit of time to hear back, but that is something that is online. You can reach out to them through email or phone. If there's questions with inspections, something maybe that you would like to appeal, there is a statute in the Health and Safety Code that allows for the facility to submit a written response within 60 days of the inspection. And then the department or the local agency then has 30 days to review the appeal and make a determination. So that is, again, after the inspection, if you find something you have questions, you'd like to appeal, you'd like the department or the local agency to review, that's also another resource too.
That's all fantastic. The only thing I'd add is, if you're, Liliana mentioned earlier that who the generator is of the RCRA hazardous waste pharmaceuticals, or those that would be considered or identified as hazardous waste under RCRA by EPA, who the generator is very important. So like she mentioned, if it's the resident, EPA would not regulate it as a hazardous waste. They wouldn't subject it to the hazardous waste management requirements. And I know you very clearly identified that carve out for RCRA and the definition of medical waste at the top of the presentation. And so we like DTSC and the Coupas also wouldn't. So, having that documentation and just probably describing to the inspector how you manage that differentiation between medications that are generated by the resident, if you have a central collection area that residents could drop them off, making it clear how that's different from maybe if you have a skilled nursing on site, like how those wastes are managed differently. I think just documenting and explaining how those are managed. And I say that with the caveat of I'm coming to learn that assisted living can be somewhat broad. It can look very different. There's a bunch of different types of facilities. So, and Liliana and I have talked about this a lot. We're trying to learn all those different iterations of how assisted living is captured and what kind of services are provided. But I think, like I said, documenting and explaining how you differentiate those wastes would be probably very helpful for the inspector.
Yeah. Glenn, do you want to talk about, some kind of practical advice here? You've dealt with these inspections. Sure. You've seen what the inspectors are looking for and what they're asking about. So can you talk a little bit about how you approach that process?
Sure. From a provider standpoint, when obviously that surveyor shows up to look at your hazardous waste, pharmaceutical waste, much like any other inspection, obviously they're entitled to do so. We want to be, welcome them with open arms. And what we found most recently, actually last week after this webinar, if you were on, I mentioned that one of our facilities we helped support was going through an inspection. The inspector took a very educational approach to the inspection. They were really just focused. The primary things they were focused on were ensuring we had a valid EPA ID number. So you mark that one off pretty quickly. ensuring that you're maintaining the manifest for all of your waste that's leaving the facility for 3 years. So one way that I would suggest you achieve compliance there is just keep a binder separated by year and go oldest to newest, or you can go newest to oldest, whatever works for you, separated by year, keeping those manifests. So when they ask for that, you have the current 3 years to be able to show them. So you mark that off their list. And then they actually want to see where your waste is stored. They wanted to look at the med rooms, where it starts, kind of, if you will, the life cycle of it, where it starts, which is in our med rooms. So they didn't specifically give feedback regarding, any specific things they're looking for in the med room, other than making sure we have the appropriate containers and making sure the containers are appropriately labeled. One thing that they did point out, and again, it was educational, was ensuring that we had labels on all 4 sides of the container. And it was not an issue. For a couple of the containers, we did not have that, but they had them and provided them to us. So again, back to the educational portion of it, they were taking that approach, so there was not a problem there. And then once we left the med room, it was really then going to where you kind of store your bulk, if you will, when you transfer it from your med room to the location where you're going to store it, why it's waiting for pickup. They want to look at that as well, making sure you have appropriate placarding on that door to identify that there's hazardous waste in that room. Was one of the big things, and that we have the appropriate waste bins that are provided by your hazardous waste hauler as you're kind of collecting that waste while it's waiting to be sent out for disposal. And one of the specific questions they asked was, how long are you keeping the waste before it's picked up, or how often is it picked up? For the facilities that I help support, we have it on a weekly basis, and they were happy with that. As long as, they wanted to make sure we weren't, keeping that waste long term. So weekly was fine. And that also helps us to stay within that small waste generator classification, because if we're doing it weekly, we don't have large amounts of waste that we're generating. So those are kind of some of the things they're looking for. And it was a 30-minute visit or so, and we have pretty decent sized facilities, but about a 30-minute visit, and they were in and out.
Yeah, thank you. I'll add a couple of things from my experience to working with some communities that have been subject to these visits. And at least a few instances, they received a visit for a hazardous waste inspection because they had a hazardous materials business plan, or HMBP, online that actually had indicated, yes, I'm a hazardous waste generator. Maybe that was an older designation or something. Maybe somebody checked out without really thinking about it, and that triggered an inspection by the CUPA. And of course, like Glenn said, the first thing they're looking for, do you have a current and valid haz waste ID number, an EPA ID number? And then he mentioned the other things about the storage of the waste and the documentation, the manifesting. But when you are a hazardous waste generator, then there are also employee training requirements. So I've seen that they're looking for that as well. They're looking for who are the employees that know where to put the waste in which containers. And then I mentioned the HMBP. That should be up to date. So another good place to start is, if you've got one of those, go back and look at it, make sure it's current, make sure it's up to date, and it's capturing all of your current operations. And
Samir?
Yes.
Sorry to interrupt you. To add one thing, because we're looking at the slide right now, one of the other things they specifically wanted to focus on, they wanted the name and contact info for the waste hauler that we had a relationship with. So they wanted to verify that waste hauler indeed was certified to haul medical waste and pharmaceutical waste, of all different types, sharps and all that type of thing. So that was another important fact.
Yeah, absolutely. And for those of you who have communities across the state under, the umbrella of one corporate entity or similar structure, you may have found that different Coupas in different areas are looking at different things and taking, either a more aggressive or more educational approach to things. Of course, your mileage will vary, but as you heard from Jessica and Liliana and Glenn, this is a relatively recent development in the assisted living community world. And so both the regulators, the state agency, and the communities are kind of figuring this out and maintaining those relationships with the inspector, and of course taking questions to DTSC when you need to or when you have the opportunity, just really works to anybody's benefit, or to everybody's benefit here. Even understanding, just because you had a community in one part of the state that was visited by a Coupa and they didn't mention X, Y, and Z, but now you've got one here in another part of the state, maybe Northern California, where they brought up X, Y, and Z. That inconsistency is obviously challenging to deal with, but it doesn't mean that that these are not obligations. It doesn't take you out of your obligations to meet the requirements. If one Coupa is kind of taking a closer look at those things.
And Samir, just to follow up on that, we do work with our Coupas, and honestly, this conversation or this issue has spurred us to plan a conversation with the Coupas to also make sure that they are consistently applying the standards. Because you're right, I mean, there's 81 Coupas, they're all going to, obviously they're going to do their best to implement the standards, but they all operate independently. So we are going to bring it up to the Coupas just to make sure they understand what standards apply. They're, to the degree that we can assist them in equitably applying those requirements. We're going to do our best. So we'll be talking to them here in a few weeks, actually.
Jessica, for the group's benefit, can you define what a Coupa is?
Oh, sure. Yeah. So the Coupa is your Certified Unified Program Agency, and they oversee several programmatic areas like underground storage tanks, above ground storage tanks, hazardous materials on site, and then hazardous waste. And those are all, there's a few other program areas, but they're all overseen by different state agencies. So in the context of hazardous waste management, they are the entities that are primarily responsible for enforcing the hazardous waste generator standards on behalf of DTSC. Now, it's not to say DTSC, we do our own inspections of generators, but also treatment and storage facilities and other entities as well. But yeah, the Coupa tends to be the one that is going to be your local hazardous waste generator inspector.
Yeah, and thank you for raising that question, Glenn, and for answering that, Jessica. I should have prefaced it. The Coupas they're separate. They're not part of the DSS world and the licensing world. They're typically either a local fire department, or they could be a local health department within a city that are certified as these certified unified program agencies to implement these programs. Okay, I've got one more slide because I said I was going to talk briefly about large quantity generators, and then we're going to get a quick update from Liliana on where things stand in California on pharmaceutical waste rulemaking, before we turn it over to questions. So as I mentioned, in all likelihood, if you're generating hazardous waste in the assisted living world, you are going to be a small quantity generator. What takes you out of that into the large quantity generator world is how much of the waste you're generating. So under the California Waste Management Act, Medical Waste Management Act, it's 200 pounds or more a month of medical waste. In RCRA for hazardous waste, it's 1,000 kilograms or more of hazardous waste, or more than 1 kilogram. Sorry, I got my little arrow there wrong. It should be a kilogram or more, not less, of acutely or extremely hazardous waste. I mentioned two substances earlier, Coumadin or warfarin, and non-OTC nicotine that are P listed. Coumadin is P listed at concentrations of 0.3% or higher. So again, you're not likely to be generating those wastes in amounts of greater than a kilogram or 2.2 pounds a month, but that's just something to be aware of. And if you are a large quantity generator, it just triggers some additional obligations, some heightened training requirements, and you'll see at the bottom a link to a fact sheet that DTSC publishes that can show you sort of the differences between small quantity generator requirements and large quantity generator requirements. With that, I know Liliana is going to provide an update on California rulemaking, and then after that, we'll turn it over to audience questions.
Sure, thanks, Samir. So, like mentioned, I wanted to provide a brief update of the pharmaceuticals rule and a little bit of background. So the US EPA's management standards for hazardous waste pharmaceuticals, or what we're calling pharmaceuticals rules shortened, sets new regulations for healthcare facilities and reverse distributors managing pharmaceuticals that are RCRA hazardous wastes. This final rule establishes standards for handling these RCRA hazardous waste pharmaceuticals to better fit the operations of the healthcare sector, while also maintaining protection of human health and the environment. So US EPA promulgated the rule a couple of years ago, but it's not currently effective in California until it's adopted. The department, DTSC, is in process of adopting the pharmaceuticals rule. Currently, we're not anticipating making significant changes to what's currently in the federal regulation text, but it's still a little early in the process to provide more concrete information. So as we move further along in the process, the department will share more information about the rule, including the new requirements, what healthcare facilities will be affected, and an expected timeline for adoption. So we're all aware when the rule does become effective and these new requirements are required. And I'll hand it back to you, Samir, if there's no questions. Thank you.
Great. So stay tuned. We'll all be paying attention to that. Okay. So we have about 10 minutes left, maybe a little bit more, to take audience questions. I'm going to see if I can see them while still sharing.
Samir, while you're looking for that, just a clarifying point regarding the short list of waste haulers we provided. We provided those three. They have a pretty broad footprint throughout California, but keep in mind that is nowhere near an all-inclusive list. There's no methodology for choosing approved medical waste hauler other than making sure they are indeed approved to haul that waste and that they service your area. So a Google search is probably a great place to start, knowing that we're spread out all throughout California, but this is a short list, just three that communities that I help support happen to use and have had a good relationship with, but by no means all inclusive. A Google search is probably your best way to, if you're looking for one, to find a reputable company to work with.
Great, thank you. There is a question from an audience member asking to review again the community's responsibility for disposal of medications that a resident maintains in their own apartment, in their own residential unit. I don't know, Glenn, do you want to do that one, or somebody from DTSC want to take that one?
I can answer a little bit about that. So again, like I had mentioned, and also Jessica did too, it's really dependent on the generator. So if it's the resident that has the pharmaceuticals and disposes, then they are not subject to hazardous waste regulations if we're talking about these hazardous waste pharmaceuticals. And I do also want to add, because it's important, that although it's not under hazardous waste regulations, there still might be other applicable regulations too. So derived from the resident, it's not applicable, or it's not required to follow these hazardous waste regulations.
Just to elaborate just a bit, everything Liliana said is absolutely correct. In the obviously the assisted living world, I don't want to make an over broad statement, but most assisted living facilities help residents manage their medication administration program. So therefore, the vast majority of medications that we're talking about, the facility would be responsible for disposing of. If you do run your operations differently, again, and your residents are maintaining or self-administering some medications, which obviously is not super common in the assisted living world, then that's where that carve out that Liliana is talking about, to where the resident could go back and drop off their medications at a sponsored take back event or something like that, and not be subject to other regulatory constraints.
Thank you. And there's a comment that was added to by an audience member that in CCRCs, most of the residents handle their own medications, right? So if in the situations where the community is managing the distribution and the collection of those, this is where those requirements come in.
Absolutely. And that's where it gets a little bit, not complicated, but obviously most people on this call are some form of a provider. So if you run a CCRC where you have different levels of care, obviously I'll use residential living or independent living as an example. Most of those residents manage their own medication. So again, they could participate in a medication take back program at the local pharmacy, the local police department, wherever it may be. That's completely fine. Again, but for that small subset of residents that may be part of a medication administration program in residential or independent living in that CCRC format, or it could be assisted living as well. Again, if we're managing their medications, meaning the facility, now it's going to fall under the facility's purview for, again, the destruction of those medications.
I would add that I agree with that, Glenn. And the only thing I'd add is this is where documentation of your practices would be helpful, because even if they collect, I apologize, I think you defined CCRC, but I'm not, it's not coming to mind what that stands for. But if the resident or if the facility collects on behalf those medications from the resident, they still would not be subject to hazardous waste standards. Like Liliana said, it doesn't mean they're not subject to other standards, but they wouldn't need to be managed as hazardous waste. But that's when that documentation that's pretty clear that these came from residents, they weren't generated by the facility themselves per se.
Mm-hmm. There's another question from the audience. What is the date that the pharmacy hazardous requirements go into effect? So what we've presented are already existing requirements. These are in effect, they apply now. Liliana did give an update on some rulemaking in California that may modify or impact some of that, but that's what you're seeing in the presentation from today. Everything here is already effective in California and is already the way is already kind of the state of the law here. I also want to add that on one of the slides where I provided links to forms to obtaining an ID number, Jessica pointed out that there was not a link to getting a federal EPA ID number. She put that link in the chat. I will also add that link to the slide presentation so that when Callo publishes it and makes it available to you all, that link will be on that slide. And this is probably a good time to share with you all the contact information for all of us that have been on this panel. We do have a few more minutes if there are any other questions.
Samir, in addition to the link you were going to update the slides with, we also put in there the EPA ID lookup link. So that link will also be, it's in the chat now. And I believe Samir will also update the slides with that as well. And that will be there as a resource for that's your starting point. You're going to go in and confirm you have a valid EPA ID number.
Thanks.
While we're waiting for questions, I guess I'll make a pitch to the attendees. We're still trying to, get a handle on assisted living facilities. They're obviously different from like skilled nursing or a nursing home. And so one of the, this issue about like when do hazardous waste requirements apply versus medical waste management act standards apply, is something we want to make sure we're providing good guidance on for you all, and then also for our group inspectors, so it's easier for them when they come on site and do their inspections. So my pitch is, if for any of those assisted living facilities, especially if you do have skilled nursing on site, we would love to talk to you all. I know our contact information's on site, just to better understand how those facilities run. Sometimes it's kind of hard to conceptualize what that looks like and how the operations are conducted. So if you're willing to talk with us, we would love to talk to you, just so we can get a better sense and provide better guidance for you all.
Jessica, you sparked one final comment regarding when you said skilled nursing. One of the things during a recent inspection, one of the first questions that were asked were, explain to us how your health center is set up. And we explained that we have skilled nursing, assisted living, and memory care. And then their follow-up question was, are you generating waste in each one of those levels of care independently? So does skilled have their own, does AL have their own, and does memory care have their own? Or are you centralizing everything? And for the purposes for our most recent inspection, we were centralizing. We were collecting everything from assisted living and memory care. Memory care is very little, and moving that to skilled nursing. And that was the carve out, and they were fine with that. That was the carve out to say, okay, great, you can just have one EPA ID number versus the need to have 3 different ones for those 3 different levels of care. So be thinking about that when you're looking at how you're going to maintain, how you generate waste, how you're going to maintain it, where you're going to store it. And if you can centralize it, I would personally be an advocate of that, because there's less requirements that you have to manage. Now you're just talking about one EPA ID number.
Yeah, that's helpful. Even just that layout, that's helpful to know that there's different care areas.
Yeah, we have one more question that came in, which is, where can we access training materials for employees? So there's not kind of a singular module for training employees on how to handle hazardous waste. The best practices that Glenn shared and that we've talked about, covering things like making sure that the waste disposal containers are clearly marked, they're secured, that manifests are kept for 3 years, and there's best practices around documenting that. So just developing a training module, you can do that in-house yourself, that covers these primary requirements that the employees who are going to be the ones coming in contact with these wastes are trained on. That's sufficient to meet the requirement. There are companies that you can pay to create a training model, but again, you don't have to do that. You can generate them yourselves, but they need to cover the requirements that we've gone over in here. And I don't know if Glenn, there's anything you want to add to that on how you develop training for your employees on this.
Just, you covered it well. We obviously spoke about PPE and the use of and making it available to staff last week. So that's an important part of your training as well. But the last thing I'd say is, if your community uses any e-learning training models, whether it's Relias or some other type of e-learning platform, I would definitely reference that platform to see what's there already in your suite of training for employees, and then assign that to the group of employees that are affected. Because remember, we don't have a requirement to train all employees to this standard. We have a requirement to train affected employees to this standard. So those that come in contact with this type of waste and they may be handling this type of waste, they need that training. So if you're using some type of e-learning module, I'd recommend you take some time, review that, make sure it's applicable and good, and then assign that to employees. Is a great way to manage your training as well.
And this is another place where documentation is key. So when the inspector comes and asks about that training, that you can show them what the training is, whether it's an e-learning module or something else, and that you can demonstrate to them you've documented who has received the training and when. So that, again, just documenting what you're doing to be in compliance with these laws and regulations. All right, we are at the end of our time. I want to thank Glenn and Jessica and Liliana so much for your insights and your input and everything you've shared with us today. I will turn it back over to you, Selena, and I'll stop sharing my screen. Thank you.
Thanks, Samir. And I also want to add my thanks to all of our speakers today. That was a really great, informative presentation. The slides and video will be available soon on our website, and we'll send a link directly to you so you have access. Real quickly, I just want to point out the chat. We have a couple links in there. One to the Policy Playbook webinar next Friday, where Heather Harrison and I will be discussing some of the bills that made it to the governor's desk this year, including the healthcare minimum wage bill and some other labor bills. We're also going to talk about the Family Council bill and the Elder Abuse Reporting bill, which if they're signed into law, they will change the way you operate. So if you're a CALA member, you're not going to want to miss that. You can sign up through the link in the chat, and that's good until Monday. On Monday, we're going to cut off, or excuse me, Wednesday, we're going to cut off registration. So make sure you do that. And also a quick survey that will help us understand how we can continue to support you on this important topic. So if you'll do those things, we'd really appreciate it. And thanks again to all our speakers.